Welcome to the Medicare Secondary Payer Resources Locating Help webinar. Our goal today is to look at Medicare Secondary Payer and the questions that you have to hopefully help you find resources. These resources should help you answer your questions, but also avoid one of our top denials. My name is Tom Ryan with Provider Outreach and Education. I'll be your presenter. Today, I'm joined by Aline Ziegler from my team. She will be helping with many of the technical questions or problems going on in the chat. She'll also send to me those questions so that I can answer them. I want to remind everyone that when you're looking at the presentation, there is a disclaimer at the end, and you may want to take a quick look at that. But just briefly, it's that it is the information was relevant this morning. We're going to try to give you only relevant information, but it could change because CMS changes things frequently. So just a little bit more on that as we get into some of the different items that you have questions on. What is our objective? Well, it is to locate that MSP help. The goal to avoid those questions so that you can find what you're looking for. As I stated, when we do data analysis, Medicare Secondary Payer is one of our top denials. It doesn't matter how you bill, it doesn't matter what system you're billing to, it is a top denial. That leads me to think, we need to talk more about it, get you what you need, so hopefully we can avoid some of those denials. So with that said, what we will do first is look at CMS resources, then we're going to look at WPS resources. We'll get to your questions. However, before I do that, I was given a bunch of questions that basically started with what is MSP? How does MSP work? Really some basic information. So I thought, well, in order to address these before we get too far into it, I do want to address those first. If you don't understand what Medicare Secondary Payer or MSP is, you'll be lost as we try to find the resources. So let me get you some basic understandings here. Medicare Secondary Payer, or MSP, is what Medicare refers to when there is someone that must consider the charges before us. Medicare may not pay the charges, even if there is a primary payer that paid before us or did not pay. It means we'll consider the charges, but only after you've billed a primary or a different source, someone before us. One of the things that comes together is when I use the word consider, what am I meaning by that? Well, that comes from the fact that if the primary insurance said I didn't make a payment, I instead applied it all to deductible. That's still a consideration. They looked at it, they determined that there is something going on with that. There is also a time when they say, we looked at it, but this isn't part of our benefit package. How many of you guys have that benefit book that defines what your insurance is going to pay for? And you have to go through all the different items within it. Maybe it's online now, whatever you want to do there. Well, once they consider it and they say it's not part of their benefit package, it can still be billed to Medicare with that zero pay. So Medicare Secondary Payer really does mean that they're just considering it. It does not mean that they actually have to make a payment. So remember, the acronym is MSP, and you're going to hear that used an awful lot. When we talk about MSP, we have a full playlist for you. The playlist is available on YouTube, and it covers all kinds of courses because we do things such as defining MSP, which is a full class, 1 hour long. We do things about conditional payments, a full class, 1 hour long, billing both Medicare systems, which is one MCS or the multi-carrier system, and two this or the physical intermediary standard system. Those are both 1 hour long. So as you can see, well, I'll get you what I can within this course, a lot more going on than we can really get to within this course. So your basic definition, again, Medicare Secondary Payer. Another payer is responsible for considering the claim before Medicare will consider the claim. The claim can be denied for not covered, applied to patient liability. It could also be paid. We just need to know what happened with the charges so that we can fully consider the claim. What's the goal of MSP? The goal is actually to affect or to reduce Medicare spending. One person did very much express frustration with the process and the need for this process, but overall, there is a reason for it. So what we do is look at the approximate saving annually from having someone pay or consider the charges before us, and that's $8 billion with a B, $billion. So when you start to think about that, that's a huge amount left in the Medicare trust fund for future payments. It can increase provider revenues. This was something that someone must have saw on the slide and they commented back. Medicare does use a formula to calculate the Medicare secondary payer claims. The formula on outpatient claims does consider or can allow for a higher payment than the Medicare allowed amount. So there's a way in which that can happen. It does decrease patient liability. So for instance, did you know that the entire Medicare deductible can be met by the primary insurance and their payments? So again, it just depends on what's going on there. And then it does avoid recovery and payment issues, which again, time, money, etc., when we can get it done correctly the first time. So that's some of the goals, some of what it does for us. I was asked about an employer group health plan and the differences. So I'm going to assume by using the word differences, what you're actually talking about are the three categories underneath, or I'm sorry, the three types under this category. Because Medicare does have two different categories, employer group health plans or employer plans and non-employer plans. Each one then has different types. The first one is what is called an employer group health plan. You can see that right here. And the employer group health plan means that the person is insured under themselves, a spouse, a child, or a legal guardian. So that have to have insurance through working, which means that they are actively working, with one exception, and we'll talk about that in a little while. But employer group health plan means, yes, there is an employer group health plan, and is also eligible for Medicare at age 65 or older, in which case the employer group health plan must have 20 or more full-time equivalent employees to be primary. If it's a small group health plan, in other words, it doesn't even meet that 20 criteria, then Medicare would remain primary. This is not determined by WPS, your Medicare Administrative Contractor, or MAC. Our job is to process claims. This is determined by the Benefit Coordination and Recovery Center, and I'll show you where to locate their information a little later on. There's also something called a large group health plan, or an LGHP. This is Medicare eligible under 65 due to disability. So the person who is eligible is a Medicare recipient. They are under 65. They are eligible due to a disability. The difference in this type of plan is that there's 100 or more full-time employees or equivalent. So the regular employer group health plan, age 65 and older for Medicare eligibility, was 20, while the large group health plan under 65 is 100 or more. I will tell you that these types of plans do not consider the patient's condition, the patient's diagnosis. They're eligible primary always. The last one under employer group health plans is a separate set of regulations in the law, and it's called the end-stage renal disease. So this type of Medicare recipient must be eligible due to the end-stage renal disease diagnosis being reported to the Social Security Administration. On average, they must wait 24 months, but not always. Now, people ask me about that. I'm sorry, the 24-month is a large group health plan. On the end-stage renal disease, they must follow the 30-month coordination period. So what is a 30-month coordination period? It means that for the first 30 months, the primary insurance, the other insurance is primary, Medicare secondary. Once that time frame has passed, then Medicare is primary and the other insurance becomes secondary to Medicare. This end-stage renal disease also has another caveat that says if they purchase COBRA, then this will maintain the 30-month coordination period unless it's passed. So it's the same coordination period. Okay? Same coordination period. So always, though, even though they're eligible for Medicare under end-stage renal disease, it's not about diagnosis because it's an employer-based plan. Hopefully that makes sense for that one. The other type of insurance works under the category of non-employer-based. These are accident, illness, or injury-based plans, so they are not primary for everything. They are primary only when it is related to an accident, injury, or illness. Those are workers' comp as defined by a state, black lung as defined by the Department of Labor, or no fault and liability insurances. So that's our super high level brief overview of Medicare. Looking at the primary payers and all of that information. Again, if you want more information, go ahead and take a look at that MSP playlist. I do want to verify from Aline that we did not have any questions come in because I don't want to leave anybody behind before we get into any of these resources. So Aline, any questions?
Tom, there are no questions at this time.
Okay, perfect. Let's move on into the CMS instructions. Now, the reason that these are important is the first set of instructions, and again, these are all available on the CMS website or instructions from CMS, are the Medicare day-to-day operation manuals. These are instructions that we must comply with, but you as a provider must also comply with. There's one area that people commonly look at and a couple that they sometimes forget. So let's talk about this and go look at these. I'm not actually going to stop and stay here. What I'm going to do is go to the CMS website and we'll look through the website itself. So as you keep in mind, you have like slide, I think it's 9, 10, 11, etc. We will just take a look as we move through these different slides. But we're going to use the website to do so. So your information may look a little bit different than mine. So as we talk about the operating instructions, first thing I want you to understand is they're called Internet Only Manuals or IOMs. And so while under Medicare, they're under regulations and guidance. Regulations and guidance. Then there'll be manuals, which is in the middle column of the body, and then you'll see the word manuals. On the left side, you're going to go to Internet Only Manuals. Now, if you scroll down, you would think everything related to Medicare Secondary Payer, or MSP, has to be in 100-05. Well, this is true. A lot of information is in this section or this information. What it doesn't contain is how to complete a claim form. And that was the question that I was asked. So bear with me as I get through this information and then we'll move on to how to complete a claim form because that's in a different set of information. So one of the things that people that I was asked about is the general information section, the MSP overview. And what I was asked for are questions. So the responses to these questions must be maintained. How long do these have to be maintained? Now the questions are a series of questions that will be asked and they must be maintained for a period of time, and that period of time is 10 years. That's the MSP question, referred to as the MSP questionnaire. It's a little bit there, but you're like, wait, also, does this provide you with what you were looking for? If not, because there's only one hit by using Control F, go back and try the next section. What's the provisions? What else might you need to know? Whatever you need to know. Let's just use chapter 3 here. Doing the same thing, you'll see, oh, wait, questions is there. Use of admission questions. This is what we're looking for. If we go down right underneath that first set, the second one is 20.1. It'll actually walk you through the CMS set of questions that you were looking for. So again, it's 100-3. Don't give up just because you didn't find it in the first chapter. It could be in another chapter, even though that may not be where you're thinking. So again, use that Control F feature, put a keyword in there such as questions and go through it. The question that I received specifically on this is, do you have to use these questions in this order? The answer is no. What CMS has done is put together the questions in a logical order. This is something you can use. This is also something that you can track with. So you can use it as a basis and just kind of track with it. You can use this in this exact questionnaire and take it right out of here, put it onto a, another form, whether it's an online or a paper form, and use that. That's the questions. And again, it's just designed to gather whether or not they have all the different types of insurance. All right, so that's one of our key resources that we were asked about. And I wanted to just really quickly cover that one. It also introduces you to the many different chapters that are here. When you're looking at it, please keep in mind there's a lot of different items you need to know and what we need to do with all of these different items. I was also asked for how to complete the claim form. Now, this person in particular told me that they bill on an 837P, which is a professional transaction. And what their struggle is sometimes when they go to have to do a paper claim form, tertiary payer situations, there's two primary insurances. they don't really know where to go to get that information. That is not in the Medicare Secondary Payer Manual. That's in the Medicare Claims Processing Manual. And there are 3 chapters. It just depends on how you bill. So if we go down, we can see here's some general billing stuff. Oh, that's all good, good, good. But let's go down a little bit further. And let's stop at 24. If you bill electronically, here's some general instructions for you. If you bill on the UB04 or the CMS 1450, here's how CMS expects that claim to be completed. And in chapter 26 is the one that we were asked about. And that's going to tell you how to complete the CMS 1500 claim form. All the different sections you can see, it actually explains item by item what needs to be there. Now we do offer a course on this, and it is available in that playlist that I had Aline put onto the chat. So if you want to take a look at that course, please feel free to do so. On the next resource is the Medicare Secondary Payer webpage. So what you'll do is you'll go to Medicare. You just kind of look through here. Which do you think it would apply to? Coordination of benefits? I'm going to go to the overview page because that's going to take me to the secondary payer page right here on the left. Now, someone said, I want to do all that. I just want to be able to search for it. Go for it. Go for it. You can search this. It'll come up. If we go to the secondary payer page, it just gives you a lot of that basic information. What I was specifically asked for, and again, look away because I'm going to scroll down to the bottom. For this resource, what I was specifically asked for is, does CMS contain training? And the answer is yes. It's on the Medicare Secondary Payer page. On the bottom, there are different PDFs that can be downloaded. Each one is a portion of Medicare Secondary Payer training, and you can read through the descriptions of each one of these. So hopefully that will help you. But in general, this page does give you your basic information, some common billing scenarios, and other things like that. If you want to stop at their download, you can look at, from a provider services or, a beneficiary service, what are they looking for related to Medicare Secondary Payer? But I really do honestly prefer this left navigation. It will help you get through all the different pieces you might need and some different items that you might want to be aware of. Okay. Which brings me to the next question and the next item on our CMS interesting information or CMS resources. I was very specifically asked for how do I find this contact information for the Benefit Coordination and Recovery Center. And that's under context right here. So again, we are just back in that coordination of benefits, the overview, the Medicare Secondary Payer, which we don't need to be in. The overview would also give it to us. Yeah, this didn't change. So if we scroll down, you'll find contacts. What's great is that this Benefit Coordination and Recovery Center is the contractor that works to update the coordination of benefit systems. The coordination of benefit systems is the actual system that stops us from paying a claim if your claim does not contain the proper primary payer information. I said the word proper, and what does that mean? I was asked if the name must match based on what we have in our system, and the answer is yes. If it doesn't, yes, you can come back to the coordination or to the Benefit Coordination and Recovery Center, have it updated. But guess what? If that name doesn't match and you're going to ask them to update it, you must get information from that primary insurance, which explains that, which explains who they are, what they are, why they use an acronym maybe versus something else, all of that. Now, I did say you can do that, and we'll talk more about that as we get a little bit further in. So I was asked for a couple of different training resources, which is why I did bring you to the Benefit Coordination and Recovery Center page, but also why we brought you to this Medicare Secondary Payer page. But also don't forget that there's a whole area on CMS called the Medicare Learning Network. This is not under Medicare. It's actually under Training and Resources. And you can see right here, the Medicare Learning Network. Now, what's great about the Medicare Learning Network is it's CMS's training spots. They're going to give you some booklets, some sheets, some different things like that. So I just think it's a really awesome resource that will help you learn what you need to know. In resources and training, right here on the top, that's what we're going to go to. What we're looking for is inside a publication, I know it's a little bit to get there, but bear with me, okay? Because I'll show you what you asked me about for the quick reference. Or not. So I apologize because it's just spinning. It's not actually opening. On the publication, oh, there we go. I like to use the word when I filter this. I don't like to use the word Medicare. Too much. But I do like to use the word secondary, and you can see it filtering down below. This is the booklet that I like a lot, especially if you're getting started or if you're looking for a quick reference. This is your quick reference booklet. If you open the Medicare Secondary Payer booklet, the first page that will open is a layout page, and this page doesn't change. This download link will change. So if they make a new version, like a new date up here, this would change. This page does not. So I like to tell people that so that if you're going to bookmark or you're going to make this a favorite, make this page the favorite, not this, because the PDF will change, the previous page will not. And what we were talking about, or what I was specifically asked about, is going to start on page 3, and you can see it's just a chart. It's a chart that says here's some things you need to be aware of. Okay, they're 65 and older. They have a group health plan, etc., etc. Here's the entitlement. It has 20 RFU. This is the chart that y'all asked me about, and this is just your quick reference. Great opportunity if you're not familiar with it. Yes, this booklet has a lot more information in it than this, but this will get you what you need to get started. Kind of maybe use this if you have someone new in your office that needs the basics. But without getting into all the in-depth basic that I gave you, they just want to know a little bit more, or they want to be able to quickly look things up. I will tell you the chart is long. It's not like it's one page, so I'm just going to scroll through because you're seeing it started on 3, and I'm currently ending on page 9. But it does help you with a variety of different situations. Okay. One of the situations I want to point out is down here. I was asked about military benefits. I'm going to assume you mean TRICARE versus VA, because if it's VA pays, Medicare does not. If the VA doesn't pay, Medicare will consider it, therefore not a primary secondary situation. Unlike TRICARE, which is a primary and secondary situation, and it's based on entitlement. Are they currently active in the military? Then it would be Medicare secondary. Now that can happen if they're disabled or something happens in the military, but they're also Medicare eligible. They can become active in the military and still not fully discharged, but they still have TRICARE as an active duty service member. Inactive, and you can see here's where we're going to go through that. So I'm not really sure what form of the military insurance you were talking about there. Again, if you need more, you want more, please put that in chat. I don't know where to go with that question other than to kind of show you this and to talk about the VA. All right, the next one, just because it's here, because I already brought it up, is if I put secondary here, you'll see that there's a fact sheet. And so just FYI, there's different fact sheets available. This is one that is available from the Center for Medicare and Medicaid Services, CMS. This fact sheet just talks about a situation that has been arising. So it's going to take a little bit right here. That people are denying services based on the fact that there is a payer before Medicare, and they're saying it's too complex. I don't want to deal with this service. Or they're saying, hey, we only deal with Medicare's primary. And what CMS is saying is you can't do that. That's not right. So they put a fact sheet together if you need more information on that. All right. One of the other areas that we asked for, which again, we've gone through your basics of the MSP booklet, all of those types of things in the fact sheet, is why is it important to understand some of these different resources on the CMS website? And let me explain that to you. The CMS website has national resources which are applicable to anyone processing Medicare claims. The information is not specific to an area or a region. The WPS resources, which is the next section and begins on slide 14, it is on our website. These resources are only for our jurisdiction 5 and jurisdiction 8 providers. So national, everyone must follow CMS. Otherwise, you have resources specifically given just for WPS providers. We like to say, if you want the guidance, you can follow this. The guidance relates to processing claims versus the resource which relates to the rules, laws, and regulation, which would be on the CMS website. So hopefully that makes sense if you're questioning that or you're wondering why I broke them up in the way that I did. Okay, let's just get caught up here. I want to remind everybody, these are what we were talking about with the contact list. These are your links. So if you don't want to have to open something, you can simply link to it. Which brings us again to the WPS website. We're going to go through a variety of resources that are available on this website. One of the very first ones that is important for you to know about, that will link you actually to a bunch of those CMS websites, is going to be available for you in the training center right here in the top. So you don't have to go anywhere. You just enter WPSGHA.com, come down, go to the training center. Once you open the training center, you do need to scroll down and you need to come to the specialty and resource services area here. And then you're going to scroll through, and it doesn't matter if you're in part A or B, but scroll through and you'll see Medicare Secondary Payer resources. And here you're going to see some of the CMS stuff that I went through and any of that different pieces of information that may be helpful to you. I will tell you, and someone did ask me about this Medicare Secondary Payer portal, recovery portal, this link is not necessarily used by our providers. They would use ours. On the other hand, maybe a legal counsel or an insurance itself. So let's talk about a third party or a liability insurance gets involved. They would use this to pay back Medicare. It's not necessarily used by our providers. And so I wanted to clear that up for those of you that were asking questions on that. And then you've got some WPS resources and different things you might want to know. Now, these resources and the WPS website are broken down by what we call Part A and Part B. Also, the jurisdictions, and I said J5 and J8. But I want to talk about that before I go any further. Part A and Part B are lines of business as assigned by CMS. They are how you bill Medicare. So if you bill on a UB04 or an 837I, you are a Part A provider. If you bill on a 1500 or an 837P, you fall into the Part B categories. This is important because one of the articles offers you guidance on how to build the system. And if you do not open the right area, you will be confused. You'll be like, I don't have that field. I don't even know what that field is. So please make sure you're aware of that. In terms of J5 and J8, what we are looking for is J5, Iowa, Kansas, Missouri, Nebraska, or the national contract. J8, Indiana and Michigan. So Indiana and Michigan, I was asked specifically, this person is actually in Ohio. They bill under their home office. And if I remember correctly, and I apologize, I think their home office was in Indiana. So they're saying, well, would I fall under national here, or because I bill under my home office, would I fall under J8? You will fall under J8 because your home office is within this jurisdiction. And you still want to make sure that you are in Part A. Remember, it's not about Part A in terms of the benefit category. It is the line of business. Okay. So you can see they look relatively similar if we switch Part A and Part B. Okay. A couple of differences will be down here. Okay. I'm going to open up a Part A item. Let's see, where is it? Here you can see this is applicable to everything, but if I said, oh, I only want something, I can open up Part A and B items. Oh, I apologize. Aline, did that pop-up box go away?
Yes, it did.
Okay, I'm glad you guys can't see it because it's stuck on my screen. So I'll just keep going and hopefully be able to move around it a little bit. So we do want to talk a little bit about some of the different resources that we have. Now, if you're looking for resources, well, you can, again, go to the training center. This will give you the fastest way to find the Medicare Secondary Payer resources. Again, I always recommend this. You could also use the tools, the topic center, and then within that. And then once you go in there, go to claims. Okay. In claims, we do have a category. If I scroll down and down and down, Medicare Secondary Payer Resources, and here are the three different things to look at. This MSP questionnaire And Part A billing. These are the two that we were talking about that can change a little bit. Scroll back up. If I flip this to Part B, it will keep the same information open. Scrolling back down, I can say I still have 3 resources, but you will see we have a fact sheet versus a Part A billing. They both give the same thing. It's just what form do you bill on? What electronic do you bill on equivalent? That's why I always recommend making sure you're in the right line of business. Very important. Um, so if we're looking at it, the physical intermediary stuff, the UB04, what we would call the 837Is, let's start with that first. So we'll go back to the top. And we'll jump down again, and we're going to go to Medicare Secondary Payer. And I probably just should have done this when we had this open. The big one to look at is this billing procedures right here. The questionnaire does explain information about the questionnaire. It's going to be our next slide, and it just kind of talks a lot about the questionnaire, when to use it, how to use it, all the basic information. So I wasn't asked a lot of information on that. On the other hand, I was asked to provide you with a billing resource. We have that available. Again, on this, and it's called the Part A Medicare Secondary Payer Billing Procedures in the Claims section. No, you don't have to like navigate to it. If you search for it right up here, it's all good. No problem with that. It'll talk you through exactly what I went through at first. It'll talk about the MSP codes that need to be on the claim. It'll talk about occurrence codes, condition codes. For those of you that just went, occurrence codes and condition codes are not billed on the CMS or CMS 1500 or 837P. So this is not your section. I know that also because it tells me that right here. And if I go to the Part B section, it says, hey, wait, no, you're not even in the right section. Okay. So again, it's going to walk you through the different items that you'll need, hopefully to help. If you want more specific information, you may want to consider looking at the YouTube video that covers this. I do want to point out there is value code 44 information. I had 3 questions specifically submitted on value code 44 and whether they're always reported. Always reported. The answer is it's never always done. Value code 44 can be submitted when there isn't obligated to accept as payment in full. And someone said, well, give me an example of when it's not submitted. Again, value code 44. What about a preferred provider organization? You get a discount by using this, but that's not a contracted provider. So you billed $100. They said, hey, we're only going to pay you $60. That $40 is not a contractual write-off. It's not on that organization's setup. Now, not all preferred provider organizations work that way, but it's one example of where you would not use a value code 44. You are not obligated to accept that lower amount. Okay. So I'll just walk you through some of the different things you need to know. Let's see. So that is one of the articles that we really do recommend taking a look at, and that's if you're billing Part A or FIS, the Physical Intermediary Standard System or Shared System. This is just a really good opportunity to read through that article. On the other hand, if you're going to bill Part B, we're going to flip over. We're going to find out, oh, wait, this isn't applicable. Remember, Part B was the 1500 or 837P. Instead, we're going to reopen claims. We're going to scroll back down to MSP. And this one does have a bit of a title that throws people off, but it is the fact sheet. This talks about the billing, the information you need for determining all of the different items you'll need to fill out that form. Now, again, the official information will always be contained within the Internet Only Manual or the HIPAA if you're doing the electronic transactions, but gives you a lot of great information. But again, not applicable to the Part A form, not applicable to the 837Is, because here it'll give you segments and loops, but they don't mean anything necessarily on the 837I. So I wanted to show you those two kind of contrast and make sure you're using the right one. We did have some questions come in and some concerns because their claims were returning to provider, which is the Part A terminology, or they were not getting paid and they were coming back as unprocessable, which is a Part B system terminology. So hopefully that helps you out with those two. Again, use the articles at your will. They're definitely there for you. The next WPS resource that was actually questioned is under tools. Right here on the top. So you can go to the top, then you go to tools. I'm just going to use all tools. What I like about this is that if I scroll down, you will see the MSP calculator. It's going to be on my screen on the left column, the third row down. Now again, depending on the size of your screen, it may be in a different location. The question that was asked is that they're trying to use the MSP calculator, but what they're trying to use it for is a outpatient hospital claim. So does that work? Well, it may not work because we have to make sure, first of all, it's the right type of MSP. So is it working age, end-stage renal disease, or disability? If it's not one of those, it's not going to work. So what does that mean? What if it's workers' compensation? That doesn't fall within this. So I'm not sure what category you were using it for. And when you say outpatient hospital, I wasn't really sure what you meant by that. Because again, an outpatient hospital can bill, any of these types of insurances. So please make sure you're using it for the right thing. But just to keep covering it, I was asked about a couple of items within this calculator. One of them is the OTAF, or obligated to accept as payment in full. This is a contractual amount from the primary insurance. Okay. So you have a write-off from the primary and you have to accept this as payment in full if they were the only coverage. This is not the Medicare allowed amount. Again, that's why it says the lower of the billed amount or the obligated to accept. What they were billed, obligated to accept, and then what they paid. This will give us a calculation here. The next one is just what would Medicare have paid if they didn't have insurance, other insurance. And the reason that this paid 100% is there, this is used for preventive services where there is no deductible or copay applied. So you'd want to make sure you check that box if appropriate. Then you also can move down and we're going to look at a couple of things. The Medicare allowed, the primary allowed, the higher of the allowed. By the way, the Medicare allowed comes from this field here. It'll automatically fill in. The primary allowed is what did they allow, what did they say on the service, and then how much is remaining. If we put all this information in, that's where the payment comes from. And then it will calculate it out. So hopefully that helps you. There is a late filing item here which says, hey, I didn't file this within 1 year, and it will give you the reduction as well. So I'm not really sure what else you needed on this calculator other than the OTAF, which I was specifically asked about, and the description, which is actually just in the hover over here. But if you need more, let me know. I can definitely cover that some more. I was very specifically asked about 2 resources. One is the Secure portal, and they're saying they're struggling to find the Medicare Secondary Payer information. The easiest way for me to show you that is to actually use the portal user manual. I don't have access to the Secure portal, which is this area here. You'll sometimes refer to it as SNAP, the Secure Net Access Portal. You may hear it referred to as the portal, but this is what we're talking about. Using the portal user manual, this will give you all of the instructions for what you want to do. I think the problem when you're looking at this area is you're not familiar with where the Medicare Secondary Payer is, where the information is at, because if you go down, you won't find anything that says Medicare Secondary Payer. On the other hand, if you stop under patient and you go to eligibility, in the eligibility section, this is where you're going to find the information you need. And if you scroll down, again, it'll walk you through and again, look away, but you're going to enter all your eligibility information. The first item that comes up is supplemental insurance and eligibility. Supplemental is what pays after us. So for this course, ignore that. We want to move to eligibility. When eligibility opens, you will be given a row or an items. Again, here you can see you've got a dark blue. That's just because they're on the summary versus the white with dark blue writing. These ones are where you have available information. Then you got the gray out items. Medicare Secondary Payer does fall into a gray out item. On this case, this just means this patient didn't have any primary insurance, but if they did, what would you find? Well, if we keep scrolling down and look away, again, if you don't like the fast scroll, I would like you to look away. I'll tell you in just a second when to look back. I'm just scrolling down and down and down and down and down and down until I come up with that Medicare Secondary Payer information section, which I did just come to, so you can look back now. So here it is. You will find enrollment and termination dates. These are key. The insurance name and address, insurance plan, or insurance type, code and descriptions, plus all this other information. This information is brought to us from the CMS Common Working File through the 270 271 HIPAA standard electronic transaction. The 270 is the eligibility portion that goes out to that, and we're in 271 is the return of that. So it's just, this is what we're given. I was asked a couple of pieces of information within this, like under the insurance name and address, why don't we have a phone number? Well, we don't get that, so we can't give that to you. We would never call the primary insurance. Like, here's the Medicare administrative contractor, so it's not something we need. Another question that was asked is, sometimes when you look on here on this record, there's a different name than what you know as the insurance, and you're trying to figure out which one to use. Follow the insurer's name on this record. And the reason that we recommend that is that's what the Medicare system knows as it. So for instance, someone said, well, we got BCBS, but you have Blue Cross of North Carolina. I think it was North Carolina. Don't quote me on that state, but Blue Cross of something. Which should we use? You should use Blue Cross of whatever. That way it tells us which Blue Cross it goes with. So that's where we're getting that piece of information. So that's definitely a tip. Take a look, make sure you got the right piece of information. Okay. But I do want to point out that you can get the diagnosis. This was another question. How do you know what the diagnosis is for an accident, illness, or injury? Right here, diagnosis associated with the beneficiary's accident or injury. One thing to remember with this diagnosis, it may have an individual diagnosis, but it really is about that family of diagnoses that can cause the denials. Okay. We were asked about direct data entry, so I do want to just take you there. Go under here and go claims. Under claims, there is a section, and I just have to get to it. Nope. Okay, I'm drawing a blank on the actual section that it's in, but there's an easier way to do it. I can go A to Z, open it up, scroll down, and I can find, oh, I'm in Part B. Here you go. Why would you need to go to Part A? Direct data entry overview is right there on the top. So because I was in the wrong section and direct data entry is only applicable to Part A, line of business, there we go. Again, here's your overview for direct data entry. It'll walk you through all the different steps, the different things you need to know. On the bottom, there is a manual. There is an area within this manual where you can find information on Medicare Secondary Payer. One of the things that's also in there, and please don't forget, is that you do need to check claims information too. And you can use either one of those sources to do that. I'm going to stop for a second. I'm going to throw Aline kind of under the bus here. She does a lot of the direct data entry education, and just see if there's something in particular she thinks I should show you, because the question was very generic. So I wanted to see if she thought there was something important that I should show you. Aline, anything?
Within that DDE manual, Tom, there is information about the fields that are required for Medicare being the secondary payer. There are what we call CAS fields. And so if any of the users need that information, my recommendation is to come out here to the manual, do a Control F, and put in secondary or CAS to find the information, and it'll tell you exactly what pages and what fields will be needed.
Okay, thank you. Like I said, Aline is much more familiar with this particular system than I am, so I wanted to make sure that you guys had what you needed more than like myself. So again, lots of information, but please take a look at any of this information should you need it. It is another great resource available to you. Let's go ahead and leave that. I had Aline put this in earlier, but I do want to show you where to find this. So on our website, you can leave our website and you can go to YouTube. Oops, sorry. That's right down here on the bottom. If you're not familiar with it, there it is. Nope. There it is. It'll allow you to visit YouTube. I don't know why it was bringing up everything else but what I wanted it to. That's going to look like this. And this is just our YouTube channel. If you're not familiar with YouTube, you can look at some of our encores on our website. I'll show you that in a moment, but I do want to point out this playlist. If you can come to our playlist, you can search through and find the one called Medicare Secondary Payer. I don't typically search, or I don't typically scroll through. I search through. And again, I use the secondary because I think it's easier. than trying to get to use the term Medicare. So here's the Medicare Secondary Payer. This is the pay list. This is a video, Don't Deny Services, a bunch of resources. Let's go ahead and open the top one again. Let's view that full playlist. You can see it does have a variety of different videos. It's got 15 videos on it, and they cover a lot of different information from MCS to FIS billing, conditional payments, kind of all of that. So just lots going on. Definitely take a look at it. It might be helpful to you. It might not. I don't know. If you're really, you don't want to go through that process and your company does allow it, you can go to our training center and again, come down and you can directly go to the Medicare Secondary Payer resources, scroll down, and you can find the playlist available also on this website, which is right here. Yeah. Just different ways to get to the same thing, but I want to make sure you're well aware of it. All right, I'm going to jump back to the PowerPoint because the next section, is some question and answers, which means I just have to scroll through everything I just showed you. So let's get on with the question and answers. So how to get coverage corrected on a deceased or uncooperative patient? Well, first I'll address deceased because in the world of Medicare, a deceased patient can have a provider update their coverage one time for one patient, and it's one provider once. It's once in the entire existence. And that provider can make a phone call to the Benefit Coordination and Recovery Center. If you're not familiar again with where to find that information, that's where you got to come back to CMS. Go to the website. Here's where I recommend it. Remember, we were talking about what? Coordination of benefits and recovery. And we're going to go out. We're just going to do the general overview. And scroll down. There's our contact list. And here's where you can go to get what you need to call them. Again, one time, okay? This is different than an uncooperative patient. An uncooperative patient, you have to get information from the primary insurance with an effective and termination date and send that information to the Benefit Coordination and Recovery Center. Again, the contact information I just showed you. On the other hand, you can say, can't get that, it's not working, can't do anything with that. You can submit on a claim-by-claim basis to them, have them deny it or do whatever they're going to do with it. And then what we can do is take it from there and process it as primary, but we have to have that. So the next question, how to know a supplemental policy from a retirement policy? Please remember that I showed you that on the website. Let's go back over here. And it's on our website. It's going to be in this portal user manual. And when you look it up, let's go back down to that section for eligibility check. And I did point this out, but I do want to point it out again. When you first get your eligibility check before you go into anything, you will see supplemental versus eligibility. Again, if it's under eligibility, MSP, primary. If it's under supplemental, then it falls after Medicare. That is the easiest way to tell the difference. How to bill Medicare when the, oops, I forgot to bring up the PowerPoint. How to bill Medicare primary when the patient has exhausted their auto insurance benefits. A couple of things you can do. One, if you can get a letter from the primary insurance saying, yes, there were benefits, but they exhausted on, make that date up, then we can take anything after that date, terminate, or not we, the Benefit Coordination and Recovery Center can take anything after that date and make it primary payer. Now, how are they going to do that? In the coordination of benefits, they're going to put an end date on it or expiration date. On the other hand, if you can't do that, then what you have to do is bill, get a denial, and once again, once you get the denial, then you're going to bill Medicare saying, hey, they didn't pay anything. So it just depends on the situation, what you can and cannot do. You could also, if you could get the patient to do it, contact the Benefit Coordination and Recovery Center and update their record. Someone asked, along with that, could you update their record with being in the office with them? Sure, they can authorize you to work on their behalf. So that's up to them to do that, though. It's up to you to do that when they're in the office. Next one is how to bill Medicare when the claim is unrelated to the primary coverage. Well, I will tell you that if it's unrelated to the primary coverage, the first thing you have to do is make sure that the primary coverage is listed correctly. So check the eligibility file. Make sure that it's not listed as an employer-based plan, any of those three those three types under that category. And the reason for that is they don't have an exception. You have to bill the primary. Now, if it is related as a workers' comp, black lung, or liability no fault, then yes, you could bill those. You got to make sure that it's not within the family or related family. If it's not, there are certain conditions you can do. Again, go back to those two billing articles that I show you and follow those. Ultimately, however, if it's really not working, you may wind up doing something called a appeal, and that's where you get into where it's the managed care appeals and the grievances and how does that work with them. So make sure you get everything related to that. What happens if the primary does not process the claim timely? First of all, Medicare does not waive timely filing for this. What Medicare will say is that you have 1 year from the through date or date of discharge on an inpatient claim and 1 year from the date of service on an outpatient claim. And that would include professional services, that would include lab services, anything outpatient basis. So if it's not inpatient, it's going to fall into outpatient or professional, maybe supplier. When you look at that, you still have to file it timely. You don't get to skip that. So make sure it gets filed timely. Now, sometimes you file it and you're like, I know it's going to deny. Well, we understand that. Then what you're going to have to do later on is go back and work with it to get it paid. Okay. So, oops. Okay, let's do a couple of more of pre-submitted questions. How to get members to update their coordination of benefits. You know, I wish I could tell you that there's an easy way to force a patient to do this. However, you can't do that. You can make a recommendation that when they come in that you give them a call. Someone from your office staff might have to spend a little bit of time with them doing that. You can always work to get information current with them through that manner, or go to the primary insurance, see if the primary insurance is willing to call us. Maybe they don't even exist or they don't have to work with us. You could also work with a legal counsel if they have that. There's just no easy way to force the member to do it. Okay. But ultimately, you could bill it to them, get a denial, bill it to us as primary with that denial, and then we'll consider it. Is value code 12 zero amount? I'm not really sure what you're asking me with value code 12 because there's no question. Value code 12 does equal working age insurance, and you want to make sure that that's on there if the employment plan is working age, 65 and older, but I'm not really sure where you wanted to go with that other than I said value code 12. So help me understand that. I'll get you more. I did do this one already, but how to locate a contact phone number for the MSP listed. One, go back out, locate the name of the company, the primary payer, then you can get an address. Once you do that, you may wind up doing an internet search to get that information. We don't have that as the claims processor. So the easiest way is to start with the name of the company and the address, making sure you're trying to match. The next question is value code 44 always used on a secondary claim? I explained this earlier. No, it's not. Value code 44 could be on a secondary when you're obligated to accept his payment in full, but if there is no obligated to accept his payment in full, then it wouldn't be applicable. So I was also asked about Medicare Advantage plans being primary to Medicare. I'm a little confused over that because they're not technically primary. They are Medicare coverage. They do not work as like a coordination system or anything like that. So if you're having issues with their appeals and grievance process, I asked Aline to put a link in the chat because I'm not really sure where you were going with that one. Other than the base question, they're not primary. You got to follow their rules and regulations. We will not pay after them. They are the Medicare coverage. With that, that is my last question. So Aline, I'm going to go ahead and advance the slide. But Aline, do we have any questions in the chat?
We do not have any questions in chat.
All right. Well, that makes it all the way to the end. So let's go ahead and clean up, and we'll let you go. So if you have not taken our survey or would like to, please provide feedback. A couple of things to keep in mind. You will get a little pop-up box. There is a survey link directly in the chat, and you're going to get an email that also gives you the opportunity to say, hey, thanks, here's your certificate, has a survey link in it. The pop-up box does look like what's on the upper right there. It's got a little triangle, things like that. It's not spam, it's not malicious. It's actually something WPS is asking you to do and CMS is asking you to do. I gave you the same link in the chat. Now on the survey, please remember to include what you liked, what you didn't like, but not just about this webinar. There will be a question about WPS as a whole. Okay. And then also on the survey, that lower left corner, you're going to have an online survey link. This is if you're doing it as an encore presentation. All right, so take that survey, give us a helping hand. We are sending out our annual Medicare participation announcements, just so everyone is aware. This is the time when, if you are a participating provider under Part B and you bill us in a certain form under the Medicare physician fee schedule, you can elect to stay with your participation agreement or you can elect to not have it. If you do not have one, you can elect to enter into one. It is good for 1 year, but will continue to carry over until you elect not to do that. So just lots of information out there available for you on that. We want to remind everybody that it is that time of year. I do see a question. Give me 1 second. So with a $0 amount in the value code 12. This is from, that is correct. Value code 12 would not have a $0 amount as far as I know. I don't have any more information on that. I would have to, probably see what they were getting at. Again, if they're telling you that from customer service and they're telling you, hey, this doesn't work, there's a reason they're telling you that. So without a claim, without being able to look at it a bit more as the customer service rep did, I don't have any more information to give you. All right, that brings us to the end. Thanks for attending. Again, take that survey. It's great to get that feedback. Let Aline and I know how we did, but overall how Medicare is doing and what you think of everything else. If you do have questions within the next 7 days, please feel free to email us. Aline just put some information in there for you. It's got the email address and that what you'll need. You can put, I'm sorry. This is MSP denials, not MA denials. That's my fault. I gave Aline the wrong title. MSP denials. So you want to make sure you're getting that information correctly in there. We will then create a response and send that back to you. Thanks for listening. We will encourage you to sign up for and to track all of the other courses that do happen. Hopefully that will help you out. So on behalf of myself, Aline, thanks for your time today, and we wish you a great day. You may now disconnect.